The best injectable is the least detectable, and that's what AesthetiCare Medspa does best. I'm here with Noreen, the filler queen. She's going to tell us all about filler and the amazing results that it produces. Now, I hear that you work with some of the, or actually all of the companies that create filler.
So I work with the companies and I go out and train accounts to be the best injector, to figure out how to place filler safely, to figure out what the contraindications are, and just make a beautiful and natural result. And so I get to go across the United States and train all kinds of different practices to do filler the best, because everybody sees the bad filler. They don't know when it's good filler because it's so natural and soft. Nobody even realizes somebody has filler if it's done well.
So why is it important that we go to somebody who knows what they're doing and is highly professional with it?
So that's a great question. And you should always, when you're going to get filler, you're thinking about it, vet the person that you're getting that filler, because people all over the world are doing filler that don't have the experience, the educational background, or the credentials to actually do filler. And so us at AesthetiCare, we only have medical professionals placing filler. Other places here in just Kansas City have people that are not a nurse, a doctor, a PA, an NP doing it, which is really scary because you're putting a medical implant in somebody's face. And so even though it's a gel implant and it's just like what we make in our body, our own hyaluronic acid, there are a lot of things and a lot of risk factors that can happen if not trained well. So at AesthetiCare, we have the top training with all of our injectors and the most education that's there. And so when I work for the companies, I go out and try to teach that to other companies. But when you're going in to get filler, you've got to ask people, how many people have you injected?
Sure.
What's your educational background? Do you have a medical degree? And if they say no to those, you're probably going to want to go somewhere else that really has that experience and that knowledge to do it well.
Now, you mentioned an injectable, or it's a gel implant.
Yes.
So is that how you would describe filler?
Yes, so filler is hyaluronic acid. We make hyaluronic acid in our body, and the filler is actually 99% mimicking what our own hyaluronic acid is.
Gotcha.
And so it's actually polysaccharide. So it's short chain and long chain polysaccharide, so a sugar compound. And these chains just bound together that bind with up to 1,000 times its weight in water. And so when it does that, it gives a nice plumping effect in areas, or it smooths out lines and wrinkles in other areas. So depending on the area that we want to treat, depending on what the patient's skin looks like and what their fat pads are doing.
Sure.
You know, as we get older, our fat pads migrate down and in, and we want to plump them back up.
Yes.
So depending on what we're trying to achieve is really dependent on what filler we're going to use and where we're going to place it. And that's the tricky part when you're learning how to do filler, is how do I assess each person individually and figure out what do they need individually, which is not going to be the same as the next person.
Right. So how does this differ from Botox?
Botox is actually relaxing in a muscle contraction. So the lines we get up here when we frown or we raise our brows, we want to mitigate those lines. We're going to use Botox to just softly relax the lines, basically the muscle contraction, softening the lines to just make it look less harsh when we smile and we see all these little lines here. So it should be very natural. It should almost look like nothing's being done. It's just you look airbrushed. So we kind of think of Botox more upper face and filler really kind of here down.
Okay, I love this all. So you guys are doing something fun for our National Selfie Day. What's going on?
So National Selfie Day is a day tomorrow where you can come in and we will use an AI app on the iPads, and we will look at you, take a picture of your face, and then add one syringe of filler, see how you look, do a side to side, add a second syringe in different areas so you can kind of get an idea of what you'll look like when that filler's placed. So that's all day tomorrow at our Leawood and our Liberty location, 9 to 5. You can come in, we'll get you hooked up on the iPad, take some pictures anytime tomorrow, and then you can really be comfortable and say, yes, I think I want the filler now that I know I'm not going to look weird, or I'm not going to have these big, huge cheeks or these giant lips, because we won't do that here at AesthetiCare.
It's all natural.
It's all natural. Yes.
It looks natural.
That's right. That's right.
Well, this is going to be a fun day at AesthetiCare Medspa for a National Selfie Day. Again, only the best here when it comes to fillers and more injectables.
Yes.
So if you guys want to attend, be sure to visit their website. All you got to do is go to greatskinkc.co. Thank you so much, Noreen.
Yes.